Well, welcome to Conversations on Healthcare, and you might be hearing some celebratory music in the background because we're having a celebration. We're marking the start of our 14th season on the air. Margaret, it is hard to believe that time has gone by so quickly.
Hard to believe is right, and I think we have welcomed more than 600 truly world-renowned leaders in health policy, innovation, and healthcare transformation to the show. What an amazing ride. And I am so grateful we've had a chance to do this.
Well, I want to take us back, way back machine. It was, I think, October 2009. Our first guest was the Speaker of the House of Representatives, Nancy Pelosi. And we've had so many other notables on, Dr. Anthony Fauci to Francis Collins. We've covered so many dramatic changes over the years, Margaret, from the passage of the Affordable Care Act to the transformations that having in genomics with CRISPR and so many other changes in telemedicine, smartphones. We've seen some real transformations happening right in front of us during this time frame.
We did, Mark, and we got a chance to see them evolve over time. And some of our guests came back 5 years, 7 years later as the state of knowledge and science and practice evolved. But then we had the once-in-a-lifetime event, we hope, COVID-19. Just a seismic event. We heard from our guests about genomic advances that led to near overnight production of vaccines. Telehealth went mainstream, and we saw unprecedented scientific collaboration around the globe. There were some dark times, but some incredible silver linings that our guests brought to share with our audience.
And Margaret, while so many things have changed, one thing won't change. We'll continue to bring you the brightest minds in health policy, health technology, and innovations here on Conversations on Healthcare. Happy 14th, Margaret.
Happy 14th to you, Mark. Many more to come.
Welcome to Conversations on Healthcare. This week, the start of our 14th season, we welcome House Majority Whip Congressman James Clyburn on the Inflation Reduction Act, community health centers, and President Biden's cancer moonshot. Now, here are your hosts, Mark Masselli and Margaret Flinter.
Our guest is the third highest ranking Democrat in the U.S. House of Representatives, but for many, he's at the very top when it comes to advocating for accessible health care for all Americans. He's always been an effective, influential, but he gained new prominence in 2020 by endorsing Joe Biden for president right before the South Carolina primary, which then propelled Biden to winning the nomination.
The Honorable James Clyburn is House Majority Whip and represents the people of the 6th Congressional District in South Carolina. And he definitely has the ear of the president and his team.
Congressman Clyburn, welcome back to Conversations on Healthcare.
Thank you very much for having me back.
As you know, as one of the biggest advocates in Congress for community health centers, and we thank you for that support, and the over 30 million Americans who are served by community health centers across our country, thank you as well. Now, of course, your work is never done. A key part of providing that kind of health care requires Congress to pass the fiscal year 2023 budget. What's the latest? Is the continuing resolution going to happen?
Well, I started this battle. I shouldn't call it a battle. Let's just say this venture with community health centers more than 50 years ago.
Mm-hmm.
I recall back when Senator Fritz Hollins wrote his book, The Case Against Hunger. And we took that book as a foundation upon which to develop the Buford Jasper Comprehensive Healthcare Program, the Franklin Feta Center Healthcare Program there in Charleston, rural missions. And I've been on a community health centers, let's just say, journey ever since. And I've always had it as my goal to try to get a community health center that is located within commuting distance of every American. And so every time legislation comes forward, I'm always on healthcare. I'm always trying to figure out how we can get community health centers to benefit from this legislation. And so it was in the Rescue Act, the Inflation Reduction Act, the Infrastructure Bill. You go through all those bills and you will see some attention being given to community health centers in order to make them more efficient, more effective, and more equitable in carrying out their duties and responsibilities. And so I'm very, very pleased with what we've done. I'm not pleased to the extent that I'm satisfied with where we are because we're not where we need to be yet. But I'm a big believer in continuing the journey. I often tell people, if you go back and look at the Civil Rights Act that we talk about so often, the 1964 Civil Rights Act, that act that we refer to didn't come in one fell swoop.
Mm-hmm.
We got the 64 Civil Rights Act was only the private sector. We didn't get voted until a year later. We didn't get housing until 3 years later. And we didn't apply it to the public sector until 1972. So it was an 8-year period. And so it is with these community health centers. I am hopeful of building out community health centers throughout the entire country to reach our goal. And I would say to people, don't deal with these things in silos. Look at the Rescue Act and see what we were doing there. Look at the infrastructure bill, the bipartisan infrastructure bill, we call it. Look at the Inflation Reduction Act, and let's see how this journey is going forward. If you look at what we did with Medicare, for the first time, Medicare is going to be able to negotiate for lower drug prices. That's a huge deal. Mm-hmm. Now it's limited to certain pharmaceuticals, but we got to keep working to expand it to others. Putting the cap on insulin for Medicare recipients. It will help about 3 million Medicare recipients, but we got to keep working to put that cap for other people as well, such as we tried to do when the bill passed the House. So the community health centers, I think, especially when you look at the infrastructure bill and see what we did, making the internet, broadband, I guess is the best way to put it, making broadband a big, big part of that so that we can connect these community health centers, the teaching hospitals and other kind of entities to make them more efficient, make them more effective, and make them more equitable. This is a huge deal. Not all we need to do, but we got to keep on working.
Well, we thank you for those efforts, Congressman. And I know that you have had Republican champions to work with on legislation to support community health centers as well. And that really has characterized the whole movement. But when we look at the enormity, the gravity of the challenges in health that face Americans, and we look at some of these innovations that have been funded over the last few years and some of the needs, the children's mental health crises and the possibility of meeting those needs in schools, the healthcare workforce shortages and the possibilities of meeting that through programs like you just described with the teaching health centers. If you look into the future, are there particular areas that you feel the health centers need to address and that you might be able to get bipartisan backing to really support, especially in our current environment?
Yes, I do. But I think that what we've got to do is expand our focus a little bit. If you were talking about making all of these programs more efficient, more effective, then you've got to look at the delivery of them as well. No matter what we may do in passing a bill, how do we get doctors and nurses and other public health professionals out in these communities? Well, one of the ways we'll do it is to look at what we're doing now with student debt forgiveness for people who work in these kinds of facilities. Just look what we've done since 2020. The public service community debt. Now remember, public service, not just if it's a public agency. You can work for private nonprofit, you can work for community health centers, and other kind of programs like that, and you can get that debt that you incurred while going to college and professional schools. And it doesn't say, you can be a doctor with a full-fledged degree, but if you work in these entities, work in these community health centers, you can get some of that debt forgiven. We have done in the last 10 months, $10 billion in debt forgiveness for I think it's 150,000, maybe 175,000 people. A lot of these people are working in community health centers. So I have said to the community health centers all over South Carolina, look, let's take a look at this. Look at the people who are working for you. Let's make ourselves attractive to them by offering them to come into these centers and get all of this debt forgiven. And they will find, I think, very meaningful and enjoyable life experiences. A lot of these rural communities will welcome them with open arms.
Congressman, let me shift the conversation a little. President Biden recently provided details about the progress for the cancer moonshot, the effort to cut cancer deaths in half. And soon we understand he'll explain specifics about federal funding to help us reach this important goal. But does the moonshot need more rocket fuel in the form of funding, as even some of the cancer advocates says it does?
Absolutely. And I think all of us are familiar with the emotional attachment President Biden has to this. Biden was a very close friend of my late wife, who suffered for 30 years with diabetes. Finally, that's what took her life. And they talked about his son, Bo, and the moonshot a lot. Because if you remember, Barack Obama first talked about this and named Joe Biden to sort of get it going. Of course, because of his personal experiences, both my parents died from cancer. My mother from multiple myeloma at a time when it was absolutely no cure. In 8 months from the diagnosis, she was gone. My dad had from prostate cancer. So cancer is a big, big deal, and there's not a single family in America that's not been touched by it. And for him to make this kind of a commitment, to name a person with such a sterling reputation to launch it, I think that we are going to get the rocket fuel that's necessary to have a tremendous and I think successful blast off of this effort.
I think blast off is a great way to describe it. And you're absolutely right. There's not a family in America that hasn't been touched by cancer. So we are very excited about that. I wonder if I can turn to another topic, Congressman. The Democratic Party, has seen really kind of a remarkable upswing in support following the Supreme Court decision to reverse the Roe versus Wade constitutional right to an abortion. I think you made some headlines earlier this year when you campaigned for a incumbent anti-abortion Democrat and said at the time that you don't think there ought to be a litmus test in the Democratic Party. But it also seems at the same time that you and Speaker Pelosi and the president are asking voters to apply a litmus test to the Republican anti-abortion candidates and defeat them in the fall. Can you comment on that for us?
Oh, I'll gladly comment on that. Look, my father was a fundamentalist minister. My mother was a beautician. Now, they did not agree on the whole subject of abortion. My mother, you would call pro. My dad was anti. But they both stayed married. My wife and I don't agree on a lot of things, didn't agree on a lot of things. But we stayed married 58 years by reconciling those differences. So I don't agree with everything that every Democrat has to deal with in his or her respective congressional district. Now, the first thing you've got to do if you're going to solve these problems is be in position, hopefully with 218 plus votes, to do that. And when you've got a candidate who is in your party, especially an incumbent, and you look at his or her district, and you know full well that certain positions must be moderated in order to be successful. Why is it that you see all of these Republicans now taking this anti-abortion stuff down off their websites? They're now moderating their positions. So yes, I did. And Nancy Pelosi, you cannot say that she is anti-abortion. She also supported Henry Cuellar, the candidate that you are referring to, because it's a number that we need to maintain if we are going to stay in charge with the majority to get these problems solved. So I am very pro-choice. I'm the father of 3 daughters, and they call me daily, and I'm not going to do or say anything that will stop them telephone calls from coming.
That's great. You're always trying to find the seam of opportunity where you can work together with people, and we appreciate that. Let me just focus on something you were talking about a little earlier about prescription drugs. The president and the Democrats are taking a victory lap of sorts for passing the Inflation Reduction Act. And as you know, drug makers are still upset about the part of the act that aims to reduce prescription drug costs. And the industry says, and I quote, will lead to fewer new treatments and doesn't do nearly enough to address the real affordability problem facing patients at pharmacies. I'm wondering if we could get your response to that statement.
I'm not too sure I know exactly what that means. I know this. I know that the cost of pharmaceuticals need to be reined in. I know what my late wife went through for 30 years with the price of insulin. Insulin has been around for more than 100 years. Insulin, we have done the research. The pharmaceutical companies can still make money with a $35 per month cap. So why was my late wife's insulin bill $800 a month? As I saw it more than once. She was a full shot a day diabetic. That was fine with her because she had the insurance, she could afford it. But when you've got people cutting pills in half, passing up insulin treatments in order to afford meals, that should not be in this country. And so nobody is more supportive of the pharmaceutical industry than I am, because that's where the research has got to be made. I support their research. In fact, the Medical University of South Carolina named their research center in my honor because of the work I've been doing to fund research so that we can get a handle on cancer, get a handle on diabetes, and look at these other things like multiple sclerosis and cystic fibrosis and all of these things that still plague us. We have to depend upon the pharmaceutical industry to get that done. But at the same time, they have to look at this cost, and they've got to deal with the issue of why it is that it's costing so much for these things here in the United States of America, and you go one step out of the country at our northern border and up in Canada, and it's costing dramatically less. There is something that has to be reined in here, and I think that all of us need to commit ourselves to doing it.
Well, Congressman, the recently passed legislation that Mark referred to also includes billion for environmental justice block grants. And we have all been riveted by reading and watching or living through what's been happening in Jackson, Mississippi, in a Black majority community when the infrastructure for safe water has been neglected and it collapses. It reminds us of what went on in Flint, Michigan just a few years ago. And we wonder, do you think we're really looking at systemic racism in the water infrastructure in the United States? And is this legislation going to go far enough, this funding go far enough to treat this not as an isolated problem, but as a perhaps countrywide problem?
You know, no, we aren't doing enough funding-wise, but we're doing a lot funding-wise. That's not been the problem in Jackson, Mississippi. That was not the problem in Flint, Michigan. We talk about Flint, but Highland Park, Michigan, right next door. In fact, I'm going to be in Michigan this weekend. I'm going to be making 4 stops in Michigan this weekend. And I'm going to deal with this issue there because I think it needs to be dealt with, not just when it comes to funding. The policies that we have, they made some political decisions. They put politics above people. Political decisions led to that problem in Flint when they changed the source of the water, and they knew, many people knew. There have been indictments coming out of that, and a lot of people say the governor of Michigan should pay a price for making some criminal decisions. In Mississippi, the governor vetoed legislation that would have solved much of the problem in Jackson, Mississippi. And that, to me, is what the problem is. No, we aren't getting enough funds out there to do it all, but we are getting enough funds out there to prevent some of this from occurring until we can fix the bigger problem. But you aren't going to do it if you've got the governor making political decisions, vetoing the stuff, because it's an 82% African-American community. That's the only reason it's there. And there's nobody in America who would believe that if that city, the capital of Mississippi, were 82% white, they would have this problem. I don't believe anybody believed that.
Congressman, a bipartisan Congress did pass a gun safety bill, but we still lack comprehensive gun control legislation, including a ban on military-style semi-automatic rifles and universal background checks. Can you tell us if voters put Democrats back in power, can they expect further action on guns?
Yes, we do. As you know, I represent the entire peninsula of Charleston, South Carolina. Emmanuel AME Church is in my district. Those 9 post souls that lost their lives there, I knew 7 of them personally. My home church is 6 blocks from Emmanuel AME Church. This is a very, very personal issue with me. And I think that we are going to continue to pursue gun safety laws. Nobody is trying to violate the Second Amendment, but this notion that the First Amendment of free speech can have constraints on it, but the Second Amendment to own a gun cannot have constraints. That is foolhardy. And if you read some of the Supreme Court decisions, Scalia, the late justice himself, nobody was more conservative in that court when he was there than he was. He made it very clear that the Second Amendment has constraints. And for us to operate as if it doesn't make a whole lot of sense. And Democrats are committed to having good, safe gun laws in order to protect people. And there is no argument that can be made for an assault weapon being in the hands of an 18-year-old without the proper background checks. In fact, they shouldn't have them at all. We should outlaw, as we did before, these assault weapons being on our streets. So yes, Democrats, by and large, and I say by and large because it's not 100%. You know, there's not 100% of Democrats that are for this, and it's not 100% of Republicans that are against it. And so what we've got to do is reach out across the aisle in a bipartisan way, ban these weapons in the hands of people on the streets.
Congressman, you also chair the Select Subcommittee on the Coronavirus Crisis, which just released a report, and it presented extensive new evidence of the Trump White House's pressure campaigns that targeted the Food and Drug Administration's coronavirus response. We've certainly heard about pressure with CDC. What safeguards is your subcommittee thinking about that might be put in place to protect FDA and CDC going forward from that kind of pressure?
Well, you know, we're here today to talk about healthcare, and that's your business and my interest at the moment. But the fact of the matter is, this fits into a larger scheme. While we are seeing, as we are turning up with the coronavirus subcommittee, a lot of the previous administration's personnel were dedicated to circumvent the law. They are dedicated to ignoring standards, doing things that didn't make a whole lot of sense when it comes to healthcare. But it was all across the board. It was this whole notion that democracy is no longer a pursuit of the American people, but autocracy ought to be the order of the day. And so these kind of autocratic decisions that were made when it came to healthcare, this whole notion of the whole herd immunity notion, making recommendations for healthcare or attacks on this virus that made absolutely no sense. This kind of craziness seems to have overtaken Washington for a brief moment in time. Let's hope that that's been arrested now and that we can begin to get back onto our pursuit of a more perfect union, letting professional decisions on healthcare carry the day. The doctors, the nurses, the people who have committed their lives to making sure that people stay well and get well when they don't stay well. These are the people that we ought to be listening to. And so what we have uncovered with this committee was that the profit motive overtook everything. Autocracy seemed to have seeped into the system, and we will be making recommendations at the end of the year as to what we think needs to be done to protect against this going forward. Now, at the same time, you got Peter Thompson, the January 6th committee, pursuing the same kind of efforts as it relates to democracy as a whole. And then hopefully the Justice Department will do its job in weeding out this cancer that has seeped into our system. So we need more than one moonshot to take place if we're going to continue this pursuit of a more perfect union.
Congressman, we hate to ask anyone an age question, but you probably have seen the latest CBS News poll that found 73% of Americans want age limits for elected officials. I wonder if that outcome surprised you, and what does it say about how we think about the skills and values of older Americans to serve in all kinds of roles?
Well, it doesn't surprise me at all, but I will say this, and it has a lot to do with the fundamentals of which I have lived my life. I think that there must be a healthy balance in all that we do. And when it comes to carrying out public service, there must be a healthy balance in knowledge and strength. It's biblical. My grandson is running my re-elect campaign because he has the strength to do so. But I don't think he can do as well as he can and must do without the knowledge that he gets from his granddaddy. So I just believe that there must be this healthy balance of strength and knowledge. And you find it in the Democratic Party. If you think for one moment that Nancy Pelosi makes all the decisions in the party, you've never met Hakeem Jeffries or many of the others in our caucus, because we are around the table with a healthy balance of wisdom and strength.
Congressman Clyburn, we want to thank you for your public service, for your commitment to healthcare, and thank you to our audience for joining us to listen today. You can learn more about Conversations on Healthcare and sign up for our updates at chcradio.com. Congressman Clyburn, a pleasure to have you here and an honor. Thank you so much.
And also, I just want to make the connection. We're up here in Connecticut, but our founding board member, Lillian Reba Moses, born and raised in Florence, South Carolina. So we've got cred up here. South Carolina's got many long tentacles.
Absolutely. When it comes up to Connecticut, which I think I'll be up there in 2 weeks.
Oh, good.
With one of my favorite people up there to try
Rosa.
to get reelected. So
that's great. Well, we look forward to it.
Run into him.
Oh, that's great. We have health centers all over the state, but if it wasn't for that trip that she made during the Great Migration to come to Connecticut, we would not be where we are today.
Well, thank you so much. I love exporting South Carolina's knowledge and strength.
We have a lot of people moving down to South Carolina from Connecticut, too.
Absolutely.
All righty.
You're welcome.
Thanks,
All righty. Take care now.
Bye-bye.
Thank you.